Hello, I am Mohammad Abolfathi from Universiti Putra, Malaysia. I completed my bachelor and master degree from Ahwaz Shahpur Medical Science University. Now I am studying PhD of Nutritional Science at University Putra, Malaysia. Currently, we are working on writing meta-analysis related to metabolic syndromes. Now I'm going to present our work as titled Systematic Review and Meta-Analysis of Vitamin E alpha-tocopherol supplementation and blood lipid parameters in patients with diabetes mellitus. Diabetes mellitus is manifested by chronic and persistent hyperglycemia over time because of impaired in secretion or action of insulin. It has been increasing greatly in recent years, affecting almost 8.5% of the world population. The primary causes of morbidity and mortality in diabetes mellitus are cardiovascular disease. Dyslipidemia is defined as increased level of triglyceride, low-density lipoprotein cholesterol, and total cholesterol, and reduced high-density lipoprotein cholesterol levels. In a situation that dyslipidemia uncontrolled, this could lead to chronic inflammation. Chronic inflammation leads to some disease such as type 2 diabetes mellitus and cardiovascular disease. Therefore, control of dyslipidemia could be an appropriate strategy in prevention and treatment of type 2 diabetes mellitus and other chronic disease. Vitamin E is one of the critical fat-soluble dietary antioxidant, which naturally exists in two forms, i.e. tocopherol and tocotrienols. The essential form is alpha-tocopherol, which is mainly obtained from foods rich in vitamin E such as vegetable oil, nuts, seeds, and green leafy vegetables. In vivo and vitro studies has shown that vitamin E can reduce lipid peroxidation by breakdown chain propagation. Randomized clinical trials have demonstrated the beneficial effect of vitamin E alpha-tocopherol supplementation in improvement of blood lipid parameters. Systematic review and meta-analysis of randomized clinical trials on the effect of vitamin E in the form of alpha-tocopherol supplementation on blood lipid parameter in patients with diabetes mellitus is scarce. Therefore, this systematic review and meta-analysis were conducted to identify the effect of alpha-tocopherol supplementation on blood lipid parameter, including total cholesterol, triglyceride, LDL, and HDL cholesterol in patients with diabetes mellitus. Method of this study. Literature survey was conducted up to October 2020. Inclusion criteria for the study. And the article must be published as a research paper and randomized parallel control studies conducted in humans. The intervention group received only either alpha-tocopherol supplement or alpha-tocopherol supplement with other intervention. Duration of intervention more than 4 weeks. And exclusion criteria for studies. The studies include pregnant or lactating women. Incomplete data. And a study without control or placebo group. Crossover cases. Literature search for this study. The selection procedure were based on PRISMA guidelines. An extensive search was performed via Cochrane Library, PubMed, Scopus, and Web of Science database to acquire the reported randomized clinical trial up to October 2020. And this term was used for the following term on abstract title and keyword and text were used, including articles, diabetes mellitus, or type 2 diabetes, or type 1 diabetes, and vitamin E, or alpha-tocopherol, and plasma lipids, or lipid profile, or serum lipid, or lipoprotein. Data extraction. Two other checked are the relevant articles. The quality of the study assessed using JADED score. The detail of the study were extracted and categorized according to Table 1. In this table, we show all the specification of included studies, including author names, country of a study, type of diabetes, study design, sample size, sex, and supplement, and placebo name, type and dosage, and duration, and BMI, and quality of study based on JADED scores. We carry out subgroup analysis. A subgroup analysis was done to determine the heterogeneity of the study by analyzing using the study duration less than 12 weeks versus more than equal 12 weeks, the dosage of vitamin E alpha-tocopherol supplement less than 700 IU per day, 700 to 900 IU per day, and more than 900 IU per day. The quality of a study according to JADED score less than 3 and versus more than equal 3. The method of supplementation, including alpha supplementation alone versus alpha-tocopherol supplementation with other treatment. The data analysis and quality assessment for this study. The data analysis was performed based on using Stata software version 14. P-value less than 0.05 was considered statistically significant. The mean with standard deviation and 95% confidence interval were extracted to evaluate the effect of vitamin E on lipid parameter in type 2 diabetes mellitus. To illustrate an existence, the percentage of heterogeneity among the included study, I-square test and Cochrane Q test were used respectively. To determine the pool effect size based on weight, mean difference, fixed or random effect model were performed. Eagers test, Biek test, and funnel plot were used to distinguish the possible publication bias. The sensitivity analysis was performed to explore the contribution of the particular study to absolute mean difference. This figure shows the flowchart of procedure of selection of studies. We included the after searching of 4 databases, PubMed, Scopus, Cochrane Library, and Abolfathi, 2,791 article plus 70 article included in the study. After excluding of non-relevant article and duplicated article, finally 10 article with 14 FXI included in the analysis. A study specification. The total number of patients in this study was 613, and the intervention group number was 302 and control group was 311. The 10 studies were conducted in 7 countries, including USA, Mexico, Iran, Brazil, India, Palestine, and Korea. 1 study was triple-blind control study, 3 were double-blind placebo control study, 2 studies were single-blind placebo control study, 3 studies were randomized placebo control study, and 1 was placebo open-label control study. The study duration ranged between 6 to 27 weeks. The dosage of vitamin E supplementation ranged from 100 to 1,770 IU per day. The JADED score indicated that one of these studies scored 4, 4 studies scored 3, 3 studies scored 2, and 2 studies scored 1. The impact of vitamin E on total cholesterol. The assessment of 12 effect size, road fixed effect, or random effect models show no significant effect of alpha-tocopherol supplementation and total cholesterol levels, with p-value acquired 0.93. And the result of impact of vitamin E supplement on triglyceride levels. The weighted mean difference of 12 effect size with random effect model demonstrate no significant effect of alpha-tocopherol supplementation on total cholesterol with p-value equal 0.80. And the impact of vitamin E supplementation on HDL cholesterol. The pool effect size of 11 effect size show no significant effect of alpha-tocopherol supplement on HDL levels with p-value equal 0.49. And the impact of vitamin E supplementation on LDL cholesterol. Using random effect model in 11 effect site indicate no effect of vitamin E supplementation on LDL cholesterol with p-value equal 0.90. Subgroup analysis for total cholesterol and triglyceride. The result of subgroup analysis remain same for the outcome except for a study with duration more than and equal 12 weeks and the study with GADAT score more than and equal 3. The finding for total triglyceride outcome remains similar in subgroup analysis. Subgroup analysis for HDL and LDL cholesterol levels. In subgroup analysis, no significant change after alpha-tocopherol supplementation was seen for HDL cholesterol except for the studies with duration more than equal 12 weeks and alpha-tocopherol supplementation combined with other treatments. The result did not change in subgroup analysis for HDL levels. Sensitivity analysis showed that full effect size for total cholesterol was significant change before and after sensitivity analysis, excluding the study by Bleu, Castillo et al. For HDL showed the same result for before and after sensitivity analysis, excluding the study by Bleu, Castillo et al. Publication bias for a study. The following plot show an asymmetry in this meta-analysis. No publication bias was reported for the effect of alpha-tocopherol supplementation on total cholesterol, triglyceride, HDL cholesterol, and LDL cholesterol. And the result of this study review and meta-analysis demonstrated that vitamin E supplementation did not affect on level of total cholesterol, LDL, HDL cholesterol, and triglyceride in patients with diabetes mellitus. However, the subgroup analysis showed that vitamin E supplementation could significantly decrease total cholesterol and HDL level when supplementation duration was more than equal 12 weeks. The exact mechanic on how vitamin E affected the below lipid parameters are not known. It hypothesized that the change in oxidation stress are mediating these effects. Prolonged exposure to oxidative stress has unfavorable impact on lipid metabolism. Vitamin E supplementation would inhibit inflammation and oxidation and improve obesity, leading to improved insulin resistance. And insulin resistance affects the triglyceride metabolism. A significant relation between serum lipoprotein and insulin resistance in patients with type 2 diabetes mellitus was demonstrated. Alpha-tocopherol regulates the gene expression regarding lipid metabolism, causing a downregulated the expression of hepatic PPAR alpha and PPAR beta and PPAR gamma. It stimulates the PPAR gamma transduction pathway, reducing cholesterol levels. Vitamin E suppresses signal protein kinase C transduction pathway, which is correlated with metabolism of lipid parameters. Power of this study. By using a random effect model in this meta-analysis, any heterogeneity between the included study was detected. But limitation for this study, the sample size of included study was small. Shortage of high quality of studies. and the baseline vitamin E deficiency was not assessed among all studies, which may influence the result of current analyses. The majority of included studies did not have data about physical activity and energy intake that could have a potential confounder in the current study. All meta-analyses did not register in PROS-Pro. Other sources of potential included articles were not searched, and the vast majority of the study originated from Eastern countries. Thus, the extrapolation of this result to Western population is questionable. Many of the studies suffer from significant source of bias. Finally, we included only trials published in English language. Conclusion: the result of this meta-analysis show vitamin E alpha-tocopherol supplementation did not affect only lipid parameter in patients with diabetic mellitus. However, subgroup analyses demonstrated that vitamin E supplementation may have a beneficial effect on total cholesterol, HDL cholesterol level, when supplementation used for more than equal 12 weeks duration. Thank you so much for your time.